Oxandrin helps people gain back weight they lost due to medical conditions like surgery, chronic infection, trauma, or long-term use of corticosteroid medication. It also helps relieve bone pain caused by osteoporosis. Oxandrin belongs to a class of drugs called anabolic steroids, which are similar to hormones made by the body. Take Oxandrin by mouth as directed by your doctor, usually 2 to 4 times daily. It may be taken with food or milk if stomach upset occurs. Dosage is based on your medical condition and response to treatment. Use Oxandrin regularly to get the most benefit from it, and take it at the same times each day to help you remember. This medication is usually used for short-term treatment only. Misuse or abuse of Oxandrin can cause serious side effects such as heart disease, stroke, liver disease, mental/mood problems, abnormal drug-seeking behavior, or improper bone growth in adolescence. Do not increase your dose or use this drug more often or for longer than prescribed. When Oxandrin is misused or abused, you may have withdrawal symptoms when you suddenly stop using the drug. Tell your doctor if your condition does not improve or if it worsens. Possible side effects of Oxandrin include nausea, vomiting, headache, skin color changes, changes in sexual interest, oily skin, hair loss, and acne, mental/mood changes such as anxiety, depression, increased anger, and trouble sleeping/snoring. For men, trouble urinating, breast swelling/tenderness, too frequent/prolonged erections, and rare cases of prolonged painful erections. For women, deepening of the voice, hoarseness, unusual facial/body hair growth, enlarged clitoris, and irregular menstrual periods, increased risk of heart failure due to body water retention, rare but serious allergic reactions. Remember, not everyone will experience these side effects, and it's important to talk to your doctor if you have any concerns or notice any other effects. This medication can rarely cause severe liver problems, such as liver failure, liver cysts, and liver tumors. If you experience sudden or persistent stomach/abdominal pain, yellowing of the eyes/skin, dark urine, or unusual tiredness, it's important to inform your doctor right away. Additionally, this drug may impact your cholesterol levels and increase your risk of heart or blood vessel problems. Your doctor will closely monitor your cholesterol levels while taking this medication. Before using Oxandrolone, make sure to tell your doctor if you are allergic to it or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Make sure to talk to your pharmacist for more details. Before using this medication, it's important to tell your doctor your medical history, especially if you have certain mineral imbalances, heart disease, liver or kidney problems, cancer, high cholesterol, high blood pressure, breathing problems, or diabetes. If you have diabetes, this medication may lower your blood sugar. Be sure to check your blood sugar regularly as directed and share the results with your doctor. Let your doctor know right away if you have symptoms of low blood sugar, such as sudden sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling hands/feet. Your doctor may need to adjust your diabetes medication, exercise program, or diet. If you become bedridden for a prolonged time while using this medication, your doctor may need to monitor your blood calcium level to prevent problems. Older adults may be at greater risk for prostate/liver problems and swelling of arms/legs while using this drug. Children may be more sensitive to the side effects of this drug and it may affect bone growth. Be sure to monitor your child's height periodically. This medication can affect fertility in males, so make sure to ask your doctor for more details. This medication must not be used during pregnancy, as it may harm an unborn baby. It's important to discuss the use of reliable forms of birth control with your doctor. If you become pregnant or think you may be pregnant, be sure to tell your doctor right away. It is unknown if this drug passes into breast milk and may affect milk production. Because of the possible risk to the infant, breastfeeding is not recommended while using this drug. Be sure to consult your doctor before breastfeeding. Drug interactions can affect how your medications work and can increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medicines without your doctor's approval. Some products that may interact with Oxandrin are blood thinners, such as warfarin. This medication may interfere with certain lab tests, like thyroid function tests, which could lead to false test results. Make sure to inform lab personnel and all your doctors that you are taking this drug. If someone has taken too much Oxandrin and has severe symptoms like fainting or difficulty breathing, call 911. Otherwise, contact a poison control center immediately. In the US, you can call 1-800-222-1222, and in Canada, contact your provincial poison control center. It is important not to share Oxandrin with anyone else as it is illegal. While taking this medication, it is necessary to undergo certain lab and medical tests including red blood cell counts, liver function, blood cholesterol levels, and PSA test. Make sure to attend all medical and lab appointments and consult your doctor for further information. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next one at your regular time. Don't take extra to make up for the missed dose. Keep your Oxandrin medication at room temperature, away from light and moisture. Do not store it in the bathroom, and make sure to keep it out of reach of children and pets. When it's expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal. And remember, don't flush it down the toilet or pour it into a drain unless you're specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.